Hello, my name is Brandon, and this is the Service Learning Project. We will be talking about Streptococcus pyogenes. I will be starting us off by describing the disease. It is in a spherical form. They develop in long chains as opposed to the grape-like clusters seen with Staphylococcus. It also shares the same cellular shape. It is facultatively anaerobic. It is a gram-positive bacteria that show purple color after gram staining. S. pyogenes, also referred to as the flesh-eating bacteria, is the most pathogenic bacterium in its entire genus. Erythrocytes are destroyed during beta hemolysis, which results in the release of hemoglobin. Protein F, a fibronectin-binding protein, is another component of S. pyogenes that enables it to cling to a respiratory epithelial cells. A fibrillar coiled coil is protein M. Another virulence component allows the bacterium to withstand and lessen phagocytosis. S. pyogenes is a potent pathogen with these virulence components and the addition of a hyaluronic acid capsule.
Techniques for studying and diagnosing. So Streptococcus pyogenes is the bacteria that causes strep throat. And so the following diagnostic tests that I'm going to be talking about are going to be related specifically to strep throat. And so a rapid strep test screens for Streptococcus pyogenes infections such as strep throat through a throat swab. So the back of a patient's throat is swabbed in order to collect a mucus sample. This mucus sample then undergoes an antigen test. And an antigen is a foreign substance within the body that induces an immune response. And this immune response leads to the production of proteins called antibodies. And antibodies bind to antigens in order to eliminate them from our system. And so this immune response has been repurposed in order to create multiple diagnostic tests for pathogens. And the most common antigen test that is used nowadays is the lateral flow test. So using the lateral flow test, the cotton swab containing the mucus sample is applied onto a nitrocellulose film. And if Streptococcus pyogenes is detected, a London antigen that is bound to labeled antibodies will appear on the film. So you can see on the right on the figure, two lines produced on the film will indicate a positive test result. And a rapid test, strep test, is great since results can be seen in just 5 minutes, so it is a relatively simple process that is not time-consuming. Another test that can be done in order to identify Streptococcus pyogenes is a throat culture. So a throat culture is typically done when strep throat is suspected in a patient, but the rapid strep test results are negative. So similar to a rapid strep test, the back of the throat is swabbed in order to collect a mucus sample. This mucus sample is then streaked onto a petri dish with a blood agar medium and it is cultured. And if colony growth is observed with clearing around the edges, then Streptococcus pyogenes has been detected. And the reason why this clearing occurs is because Streptococcus pyogenes is a beta hemolytic bacterium. And beta hemolytic bacterium completely break down or lyse red blood cells. And so as the red blood cells are completely lysed, this clearing forms around the edges of the colony. And it is because of this that this culture can be used in order to diagnose Streptococcus pyogenes outside of clinical settings. So this can be done in lab settings in order to identify Streptococcus pyogenes and other beta hemolytic bacterium in samples that are being tested on. And so while a throat culture may give us more accurate results, it does take over 24 hours to complete, as you do need to incubate these plates in order for growth to occur. And so that is the reason why a rapid strep test is typically preferred when you're testing for strep throat, as it does give us results at a much faster time.
Pathogenesis mechanisms and ecological impact. S. pyogenes is commonly detected in the upper respiratory tract or in the skin. Typically, these organisms spread through direct contact with discharges from the nose and throat of infected people, or by contact with infected wounds or sores in the skin. So usually when someone with the infection coughs or sneezes, or if they're even shared food or drinks, can one be contaminated with this bacterium. You can also pick this bacteria up from the surface and then transfer it to your nose, eyes, or mouth. So, it's always important to make sure your hands are clean before you touch your face. S. pyogenes produces a variety of pathogenic virulence factors, including hemolysin O, which allows for the lysis of red blood cells, hyaluronidase, which serves as an enzyme that facilitates decimation through tissues, and M proteins, which manage to resist the process of phagocytosis. Mechanisms against host defenses. As pathogens, S. pyogenes have developed complex virulence mechanisms to avoid host defenses. The M protein and M-like proteins are very important factors that manage to resist immune responses from both your innate and adaptive immune systems. Encoded by the M gene, the M protein is an immunodominant protein consisting of a coiled alpha helical structure deposited on the surface of its cell wall. To gain resistance, this bacterium recruits specific human proteins like C3b and S. pyogenes antibodies to its bacterial surface where these M proteins lie in order to prevent the process of opsonization from occurring. This, of course, enables S. pyogenes to evade uptake and consequent killing by phagocytes. Their ability to adhere to host cells and block phagocytosis is a truly fascinating adaptation that eventually leads to their colonization through their body. Such protein is essential in pathogenesis as it gives the organism the ability to evade innate immune players like macrophages, dendritic cells, and neutrophils. Variants among sequences of M proteins make it challenging to identify a conserved protein domain that can be targeted in order to disrupt this invasiveness mechanism that they hold. Its ability to hide within the human cell or in the endothelial barrier manages to leave the host asymptomatic for a few days. After a few days, eventually this hiding mechanism allows the pathogen to spread and colonize the throat and initiate the occurrence of mild symptoms such as throat pain and swollen tonsils, along with fevers. As you leave this S. pyogenes untreated, rheumatoid heart disease begins to develop. The lack of medical resources and adequate treatment allows this disease to be found most prevalent in developing or non-industrialized countries.
At part 4, I'm gonna talk about the disease strep throat. Just wanna let you know that there are more than 3 million cases of strep throat in the US per year. Streptococcus pyogenes cause the infection named strep throat, one of the most common bacterial infections in humans of all ages, especially children and elderly. So children and elderly are most likely to get infected because of their weakened immune system. Strep throat is a contagious airborne infection. The bacteria are present in respiratory droplets and saliva. So when infected people cough or sneeze, they are released into the air or drop on the surfaces of objects. People get infected by inhaling the bacteria in the air, consuming contaminated food or drinks, or touching the surfaces and transferring the bacteria into eyes, mouth, and nose. So, what are the signs and symptoms of strep throat? The Streptococcus pyogenes cause the inflammation of tonsils and throat. So they get red, swollen, and painful. Patients may experience painful swallowing. Tonsils may have white patches or streaks of pus. There are tiny red spots on the soft and hard palates. Lymph nodes on the neck also get swollen and become tender. Patients may experience coughing, sneezing, headache, body aches, rash, nausea, and fever. Seriously, strep infection may lead to very serious complications like infections in tonsil, sinuses, skin, blood, and middle ear. Inflammatory reactions also occur like scarlet fever with rash, kidney inflammation, rheumatic fever that can inflame or make the heart, joints, brain, and skin swell, and post-streptococcal reactive arthritis, that is a joint inflammation. What are treatments for strep throat? Strep throat is a bacterial infection, so antibiotics are, of course, effective to treat it. Antibiotics are made to cope with the metabolism pathway of the specific bacteria. Some oral antibiotics may be efficiently used in strep throat treatment like penicillin, amoxicillin, cefalexin, or azithromycin. Symptom relievers like ibuprofen, acetaminophen, and aspirin can also be used to relieve sore throat and fever for the patients. However, patients must visit doctor as soon as possible to have early treatment with prescribed antibiotics in order to reduce the chances of getting worsened complications. So, how can we prevent the spread of strep throat? We should practice the proper hand washing. That is the best way to prevent most infections. Keep your hands away from eyes, mouth, and nose. Cover your mouth and nose with an elbow when coughing or sneezing. Don't share personal items like drinking glasses and eating utensils. Don't share food and drinks with someone else if either you or they get infected. If you have to have close contact to take care of the patients, wear a mask to cover your mouth and nose and wipe the surfaces with alcohol. Here's the references of our group. And thank you so much for listening.